I am Dr.K Gireesh, physician, neurophysician and neurosurgeon, and today as a part of the health bouquet, that is a health awareness program for the public on medical subjects, and the topic I am speaking is the fifth component of sleep, and this is a sleep disorder. Today I am in fact speaking to you. I did speak on the stages of sleep, as well as I did speak on how to diagnose sleep disorders using polysomnography as well as MSLT, mean sleep latency test. Now I am talking about one sleep disorder, that is obstructive sleep apnea, called the OSA syndrome. Now this is a sleep related breathing problem. This condition affects 3 to 7% of the adult population and about 1 to 4% of the pediatric population. Obstructive sleep apnea, this is called OSA. It is characterized by repetitive episodes of apnea, that means no respiration at all, and partial airway block obstruction called hypopnea occurring during the sleep. So, what you find is during the sleep, you will find there will be phases in which you may not be breathing at all, that is apnea. So, obstructive sleep apnea is characterized by repetitive episodes of apnea and partial airway obstruction occurring during sleep, resulting in oxygen saturation fall and a disturbed sleep called fragmented sleep you call. Whenever the saturation falls and apnea occurs, it will stimulate the respiratory center again, he will just get up. So, he gets a disturbed sleep. And these people with obstructive sleep apnea will have excessive daytime sleepiness, sleeping during the day with loud snoring. So, this is one of the characteristic features of OSA, excessive daytime sleepiness and the presenting system with the loud snoring. Polysomnography may be helpful in diagnosing obstructive sleep apnea as well as determining the severity of obstructive sleep apnea. In adults, the polysomnographic recording will show at least 5 or more scorable respiratory events per hour of the sleep, with evidence of increased respiratory effort during all or a portion of each of the respiratory events. Suddenly there will be a struggle and they will be breathing again. So, the breathing goes, normally he sleeps with the breathing pattern, and then what you can see, you find he goes into a no breathing phase, suddenly there is an effort and he starts breathing again. So, this is called fragmented sleep, where the person might be getting up in between the sleeps. In children, the polysomnographic recording will show at least 1 or more scorable respiratory events per hour of the sleep. Now, how can this be treated? Therapy, that is a medical management, is directed towards the correction of the upper airway obstruction. There is something obstructing. Maybe some abnormal anatomical factors are there in the oropharynx. Administration of a PAP by means of a nasal mask is the most frequently used therapeutic modality. So, giving oxygenation during what you can say the breathing, it's when you are sleeping, you sleep on with the PAP mask. Surgical procedures are sometimes the first line treatment in children, especially they have tonsils, big enlarged ones, that can occlude and produce this respiratory difficulty. So, that adenotonsillar hypertrophy is there, tonsillectomy will have to be done. In rare cases, surgery may be helpful when a discrete structural abnormality produces airway obstruction can be identified, like the ULA. In mild cases, significant improvement is achieved by preventing sleeping in the supine position, or by you can elevate him and what you can say he can lie down the head and trunk, or little of altering in the position, it will be fine with him. Tongue retaining devices and other oral appliances may be beneficial in a small number of instances, particularly when the respiratory disturbance is very mild. Weight loss is often beneficial in patients who are morbidly obese. So, there what you can say, you can have weight loss. So, management, one is relieving the upper airway obstruction in children, especially tonsils, to be removed if it is very big, and then of course, PAP using oxygen therapy will be given, and in mild cases of course altering the sleep postures from supine to either to one or the other side, or what you can say head elevated, then sometimes tongue retaining devices and other oral appliances can be beneficial in a small number of cases. So that's in brief about obstructive sleep apnea, which is a sleep related breathing problem which is associated with a sleep disorder. Thank you very much.